Hello everyone, my name is Omolere Beauty Olatawura, a data analyst intern with Mentorness. Today, we are going to be looking at an analysis I did on COVID-19 data set sent to us. The COVID-19 dataset contains comprehensive information regarding the spread of the coronavirus pandemic across various regions and countries. It encompasses a wide range of attributes, including the date, location, total confirmed cases, deaths, and recoveries. It also offers a detailed perspective on the progression of the pandemic over time and its impact on different regions globally. Some of the key features of the data set are temporal analysis, geographical coverage, granular data, data integrity. And some potential application of this data set includes epidemiological study, forecasting model, policy analysis, and of course, public health surveillance. Why is this analysis important? Some of the purpose for this analysis includes understanding the dynamics of the disease, the transmission pattern, geographical spread, and its impact on different populations. Assessing public health interventions implemented to control the spread of the disease. Identifying vulnerable population using demographic characteristics like age and others. Monitoring healthcare facility, informing policy decisions, and supporting research efforts. The COVID-19 data set used for this analysis contains information about the spread of the virus across various regions and countries. Some of the statistics in the data set include columns like date, country or region, confirmed cases, deaths, and recovered cases. Each record provides for a specific date and location detailing the number of confirmed cases, deaths, and recoveries. The total number of records in this data set is 78,386 records. The date column talks about the date of the observation, the date the test was carried out. The country or region is specifying the geographical location where the observation was carried out. Then confirmed is the number of confirmed COVID-19 cases. Death, the number of people that died due to COVID-19. Then recovered, number of recovered COVID-19 cases. The data sets allow for the analysis of trend over time, geographical comparison, and insight into the impact of COVID-19 on different regions. Data cleaning. What are the steps we took to clean the data set, knowing full well that some data may contain inconsistencies and errors? So, the steps we took in cleaning these data sets were: first, we checked for null values using SQL queries. We updated the null values with zeros for both confirmed deaths and recovered columns. Then we converted data types to ensure numerical calculations could be performed accurately because we had series of calculations. Formatted the dates column to ensure uniformity and compatibility with date functions. Now, what were the challenges we faced during the data cleaning? The first one was handling the non-values. Second was data type conversion. And we also encountered challenge with the date formatting as listed. Explanations of the non-values, how we handled them. The non-values, of course, represents missing or unknown data points in the data set. In the context of this COVID-19 data set, non-value indicates missing information for confirmed cases, deaths, and recoveries on specific dates or in the specific region. The approach we took in handling the non-values were: first, we had to identify where they were which rows and column had missing data. Secondly, we had to replace those known values with zeros. Then we also had to convert some data type from varchar to float. This is to ensure uniformity and compatibility for numerical calculations. Also, we formatted our date column appropriately to ensure consistency and compatibility with date functions in SQL Server. The result we got from handling these known values includes making the data set consistent with no missing values. Also, data type consistency and date formatting standardization. The first analysis we have here is the monthly average of confirmed cases, deaths, and recoveries. This visualization here shows us the monthly average of confirmed cases, deaths, and recoveries over a specific month. In a specific month, peak and troughs in the line chart indicates the period of increased and decreased activities. You could see where activities increased here, and you see decrease. So it was always fluctuating. Now, the trends over time. We observed variation in the number of confirmed cases from month to month. This is an indication that there were changes in the spread of the virus. Peaks in confirmed cases indicates period of heightened transmission or increased testing. The trends of death over the time provide insight into the severity and impact of the virus on mortality rates. Fluctuations in the death rates may be influenced by factors such as healthcare capacity, public health measures, and the efficacy of treatment protocols. Monitoring the trends of recoveries help assess the effectiveness of healthcare interventions and the resilience of affected populations. Increasing recovery rates over time indicates improvement in medical care, vaccination efforts, or the natural cause of the pandemic. Here you have on the y-axis you have the average, and the x-axis you have the months. The wine colored line indicates the average confirmed cases, while the yellow line indicates average recoveries, and here the orange line indicates average death. Then our second analysis was on the most frequent values of confirmed cases, deaths, and recoveries. Here we have a bar chart to show us the results. The analysis identified the most frequent value for confirmed case, deaths, and recoveries. Here we have most frequent confirmed, most deaths, here we have most frequent confirmed, yes. Here we have the most frequent recovered, and here we have the most frequent deaths. For each month, the value that occurred most frequently in the data set was determined, providing insight into the dominant trend or pattern. How do we interpret these charts? The bar chart visually represents the predominant value for confirmed cases, deaths, and recoveries in each month. By comparing the frequency of these values across months, we can identify trends or anomalies in the data set. Consistent or increasing frequencies of certain values may indicate stable or worsening condition, why fluctuations could suggest variability in reporting or data collection method. Understanding the most frequent values for each matrix help in assessing the overall trajectory of the pandemic and identifying potential areas of concern or improvement. What were our key findings? The dataset provided comprehensive information on COVID-19 cases, which includes confirmed cases, deaths, and recoveries across different regions and time period. Data cleaning procedures were implemented to address known values, ensuring the integrity and accuracy of the data set. Monthly averages of confirmed cases, deaths, and recoveries were calculated, revealing trends and patterns over time. Analysis of the most frequent values for each matrix, providing insight into prevailing trends and potential area of concern. Insights gained. The dataset showed significant variation in COVID-19 matrix over time and across different regions. Monthly averages highlighted fluctuations in the spread of the virus and the effectiveness of mitigation methods. Identifying the most frequent values for confirmed cases, deaths, and recoveries shed light on the dominant trend and patterns in the data. Further analysis suggested on this data set could further analysis, this data set could explore correlation between COVID-19 matrix and various socioeconomic factors such as population density, healthcare infrastructure, and government interventions. Time series forecasting could be developed to predict future trends in COVID-19 cases. This is to enable proactive decision making and resource planning. Comparative analysis can be done on these data sets from other infections, diseases, or historical pandemic could provide valuable insight into the unique characteristics of COVID-19 and inform public health strategies for future outbreak. Our references. The data set we use was gotten from a reference file for corona data provided by Mentorness. The tools we use for analysis includes the SQL Server for data manipulation and querying, Microsoft Excel for data exploration, and of course, did visualization on this Microsoft PowerPoint presentation. Thank you very much for your time. I really appreciate the opportunity to walk through this with you. I hope that the analysis and the insights gotten from this would inform quality decision making by your organization, and I hope that I'll have more opportunities to work with you again. Thank you so very much. Have a wonderful day.